Yes, I will also say that. Good afternoon, friends. Uh, I have promised some of my group of friends that I was going to show them, this fruit. It's a unique fruit. It's been around. It's been around for centuries. Native people, or what do I use the word? Local people know about it. It's called. Help me pronounce it.
Osu.
Osu. Yes.
That's Bini.
No, don't go away. You are talking. You are in the video. It's show. You can position. You come closer to this place. So that once you see good. So I'm Dr. Kennedy Eweka and
I'm Dr. Felix.
Dr. Felix Abovo. So we are not medical doctors. We are artists.
Academic doctors.
We are academic doctors. We are intellectuals. Somewhere last week, I went into a restaurant to eat, and I was asking them because I was having this sugar spike, high glucose in the bloodstream, and it was affecting me adversely because I was on orthodox medicine using glucophyte, and the drugs was too strong for my system. And it wasn't, I wouldn't call it adverse effect. I was becoming even more dizzier than I was before. So, and feeling very unbalanced. So I went to this restaurant, and I was complaining, people have wheat or amala. I wanted to eat something that would have less carbohydrate. So I was complaining. They also gave me soup that was very salty. I ate it, and I was complaining. So somebody now said, "Excuse me, sir, have you heard of Osu? Osu or Mosu?" He said, or Mosu. I said, no. He said, okay. He said, go to any of these our market, wherever they sell these native things, these herbal things. He said, yes, in Benin, we used to call it Owa Kemi. So I went to the particular shops, and I discovered that it was everywhere. So I bought one for 500 naira. So I bought more than enough. But the guy who told me, he said, man, he said, try and use this thing. He said, you will come back and thank me later. But I didn't want to argue with him, so I went home and did it exactly how he asked me to do. Can you get me that knife? Yes, sir. So he said, both the fruit and the seed. And the back. I'm going to cut one, whichever one out of the two. But sometimes you mistake it for pear. It's not affogato pear. This is just a fruit, an independent fruit, different from affogato pear. It's also not orange, So he said I should just cut it in smaller pieces and put them in a container and pour water. Just put water. We will demonstrate it here for you for your benefit. And then take one shot, in the morning. Take one shot in the morning and one shot in the evening for 7 days. So I decided to try it out. The first shot in the morning proved very positive. I find out that I was a bit balanced then. But please, before we go on, you should not approach this herb or this fruit without having your glucose meter, without having your blood sugar glucose meter. This is affordable to buy. I bought this one on Jumia for about 6,500. Please have your glucose meter, because we as human beings have what we call the optimum level for this sugar level. You should not reduce it beyond that level. Well, for some of us, if it is 140, it's okay. If it's 120, it's okay. 130 to 110 is okay. But that is why I said it does not concern those people suffering from low sugar level that are already reading 77, 78, 69, 90. Please.
Those people, they even need sugar.
Please don't go near this. Okay. Should we say that if it is 100 mg, please stay away from this. We beg you. Don't come and say because I mention sugar. I'm only talking of those who have type 2 diabetes, not type 1. Please, people have enough who produce too much insulin to reduce sugar in their system should not go near this. I think that is where it's spoken. So now I will want to open it in case if you have it in your local environment, so you know what it is. Can you come and cut it? But be careful, please. It's a bit hard.
I hope the knife is sharp enough.
Don't cut your handle.
Don't want to cut your handle.
See, it's a bit tough, eh? It's a bit tough. But if we're in the kitchen, you could use stick to heat it up to kind of help yourself.
No, it's cutting.
It's cutting it. Okay, good. Very good. Beautiful. So let us now show them how it looks like. You can see this is not mango, please. This is not mango. It is also not pear. It's called Osu in Benin. I don't know the English word, but probably maybe from this video you can do more research and check what the English or the botanical name. Botanical name. You see, this is how the seeds are. You can see it. It has seeds. It has seeds. So what we are going to do now, both seed and the skin are useful. You just cut them in pieces to size any container that you have. If it is Ragolis bottle or whether maybe a big can, just cut them to size, and that will just be it. Can you now face it downward now? It's easier to now slice now at this stage.
You can remove this.
We can now, please permit me now to remove this. You can look at it very well, please. You know. So it's a kind of, don't cut your hand because that is not what we want to achieve here. Is it that I should hold the
knife is not too sharp.
If we can just cut that one into two, that would just be enough for us to demonstrate this video. Okay. Good. So thank you. Then we can now further pieces it now, chop it into smaller bits. You know, we chop it into smaller bits. Cut into smaller bits. Do we still have enough time there? Or we are?
Yes, sir.
Okay, good. Cut it into smaller bits. No, don't taste it yet too, because do you know your sugar situation? No, do you know your sugar level? No, don't go there.
No, to test doesn't it won't.
No, but I mean to say that at least I don't want it because more research need to be done on this.
Even if this thing touches our tongue, she will spit it out.
Okay, good. No, it can be ripened, but it's always good to use the green one. But you can also use the ripe one if you see. So you put the chopped pieces inside your can, both the seed and all. You don't need to leave anything out. I've not tested it the way it is raw, but I feel that somebody who have you done it before?
I have, yes.
You know you have done it and it's quite bitter,
very
very bitter, extremely bitter.
In fact, I do not see anything that is as bitter as this.
As this, okay, good.
Yes, vinegar.
You can't say, but have you ever taken vinegar? Do you know what vinegar is?
I've tasted vinegar. This one is, the taste is
more biting.
Than vinegar.
But it also have, apart from that, it tastes bitter. Its health implication on the user is enormous. It balances your metabolism and helps you to recover. So that a week ago, I wasn't myself since last year till now, but now you can see I'm very active. Thank you. And for those of you who are married, when you use it, you will know. I'm not talking of your married ones. So
you go and tell the stories.
You go and tell the story that at least, because when your sugar level is coming back to the optimal level, you will perform well now. Thank you. Now I can now finish up the pieces. But that is not part of what we are saying, though. Just aside.
No, it's one of those things.
No, it's just aside. But we are more particular about the reduction of the spike, and with no side effects. I'm not saying the orthodox drug was bad in a way, but I couldn't deal with the side effect of some of those drugs. That was the problem. You know, trying to reduce the sugar, then creating further complication became something I just didn't understand, because I was not getting ill by the day trying to deal with the. This one you can eat, although you can eat anything. Oh, once you eat anything and you feel that the spike is up, just take a little shot. It will neutralize it. That is the good part. Let's put it back inside this can. Get us 2 sachets of water there. Okay. Get us 2 sachets of water. Okay, that just.
No, to pour.
I will guide it with my hand, because I'm actually going to take this one and mix it now. So now that we have it here, you just pour water slightly to cover it. You can burst the water and, you know, pour slightly to cover it. Oh, very, very good. Very, very good. This is just excellent. You know, you just pour water slightly to cover it, to just cover it. And that will be it. And what you need to do is, because I've eaten about a few minutes ago, I wouldn't want to take it now. Because if I take it now, I'll feel.
No, normally you leave this thing for.
Yes, for a day.
12 hours.
Yes, a day. Like it's missed now. By tomorrow morning, first thing in the morning, you take a shot. You just take 1 shot, one small glass shot, and on empty stomach. Take it first thing in the morning before food. You will discover that you'll be looking for food in less than 30 minutes after taking. In fact, some people it's almost immediate. You know. Then after, just before going to bed, you take a shot and sleep. But while you're doing that, immediately you've done 1 day. The second day, you will go for your sugar meter to check so far what has happened to you. Your level of the sugar in your blood. If it's like, can we start with 300 for instance? If it's 300, because mine was 300. Yeah, mine was 300. So if 300. It's 300 mg. So if it's 300 and you take this shot first in the morning and second that day, you'll be okay. Then you probably could see without glasses. Drive without glasses. I was almost driving with. I had to do a medicated glass, driving with glasses. I discovered that day I could drive without my glass. Now, by the next day, I did the thing. It now dropped to 270 or 270 something. Yeah, it was not. Now, as I've done it for 1 week now. As at yesterday, it's about. I think what was read yesterday is recorded in the meter. You know, let's see. If you just click it, if you click it here, that is it will start from. You can see it. 160 is here, but that was not yesterday. If I click it again to start from the first, okay.
That's the memory.
Yes. Okay, let's start again. You see, okay, you see one. You see, okay, 160 was what was read yesterday.
From 300.
From 300, 160. So, but because of that, I still need to take it because my target goal, my target goal is 140, 45, 130. Then I will stop. Then I will continue to monitor my sugar level. Once it's going up again to like 180, then I will do a few days, maybe 2 or 3 days. It just easy. You just get by with it. It's around. It's available. So I just hope I've been able to, make my little contribution. But the reason why I'm making this video free for all is because the man who introduced me to it didn't even know who I was. Just told me, but he said that when it's after a week I'll come and thank him. But since I don't know where to find him, this is part of the thank you. But I'm actually going to look for him because I said, "Who are you?" He said he's Dr. Miracle. Have you heard of that name before? Okay, so I'm going to use that word. I'm going to use that name, Dr. Miracle, to locate who this man was, who introduced me to this. But because it was good for me, I don't know. That's why I'm introduced to the word. Don't allow your neighbor, don't allow your friends, don't allow your colleagues to just die for nothing. If you know the person is suffering from sugar spike, glucose spike, you can get these things around. But if you are not in Benin, and you are not sure, call some of us in Benin City, call any of your friends and say you are looking for pig. Can you pronounce it for them again? Osu-fruit. Osu. And those market women will locate it for you. And you can buy as many as you can buy. And they will send it to you through any of these transporter. And you use it, follow my demonstration. You'll just be okay. You'll be fine. You'll be fine. In as far as you can keep to your diet if you can afford it. But it's expensive to keep to diet. Are you getting me now?
Yes,
it's expensive to keep to diet. But those of you who can afford to keep to diet, okay, you should keep to diet. But if you cannot, still eat your normal food, but also have this very close by to you. I appreciate you. Thank you, and God bless you.
Thank you.
Yeah. But you people have any question?
No, sir.
Any question? Okay. Thank you.